So, hello.
How are you?
Good. How are you? Is it Shreya?
Shreya.
Shreya. All right.
Shreya.
Do you have a microphone by any chance?
It's like weird. Better? Okay, perfect.
There you go. We're all set.
Right.
Good.
I'm super excited to talk to you because, like I said, I've been like watching all your podcasts, or not watching, but I listen to them like on my rotation, like on the way to my rotations every morning.
Yeah.
So it's awesome because I'm like, this is awesome. Like somebody like who went through what I'm going through right now, who's like, actually, this is great. Anyways.
Yeah. No, yeah, dude, this whole podcast thing it started out with something just as this little project, and then it just it's like the amount of emails I get is insane. If you were to like look through my inbox, I could
even imagine. Nope.
So anyway, I'm having a ton of fun doing it, and I did some interviews in the past. I've gotten requests to do interviews, but I was just so slammed. I think it took me a month to get back to you.
Yeah, no, it's totally fine.
Yeah, usually I'm pretty good, but for whatever reason, I knew I flagged your email, so I just had to go back and find it.
Awesome.
But yeah, I'm glad we can chat, especially, you had this interesting or unique path and journey there.
Yeah, definitely.
So yeah, if you want to get right into that, we can just start off with a quick little intro as to who you are, and then we'll just kind of take it from there.
Okay. So I'm Shreya. Obviously, I'm a PA student. I'm in my clinical year now, and I graduated in 4 months. And I'm super, super excited for that. That's all I can ever think about, because I just want to be done with it and just be a kick-ass PA. So that's pretty much.
Okay. And you're going to school where?
So I'm at Towson University right now. It's a joint program with the community college here. So it's CCBC Towson University. It's in Maryland.
Okay.
Yeah.
Awesome. And this is your second school, right?
This is my second school, yeah. So I originally started PA school about 3 years ago now.
Okay.
So it was a 2-year program originally.
Oh, wow.
And it was...
so the transition took an extra year of your life.
Exactly. Oh. Yeah. The transition alone took an extra year because I started at a different school than the one I'm originally in. That PA school was also in Maryland. Mm-hmm. Unfortunately, right as I was ending didactic year, like literally 2 months before we were starting clinicals, we lost accreditation.
Oh shit.
And it was extremely stressful. Like, it was probably the most stressful I've ever been in my entire life. Like, if I had to like think about all the events I've had in my life, that was probably the most stressful.
For sure.
But what was awesome was that there's a university system of Maryland, and that's where all the PA schools, or I think all the graduate schools, are a part of.
Okay.
And they pretty much took in our school, and there's 2 other PA programs in Maryland, and basically my classmates were split up into those 2 programs.
Oh, so everybody went different directions.
Yeah. So,
oh, wow.
And honestly, it wasn't even split in half, because 24 students went to one program, and then 9 students went to another program, and I went to the program with the 9 students.
Yeah. Wow.
So it's pretty insane, because I feel like when you're in PA school, just from my didactic experience, like, those people become your family, like you're always around them. Mm-hmm. And then to have to be just like taken away from that, and then, here, we're going to put you in another place. It's like, when you're younger, and it reminds me of like, and then you have to constantly keep moving.
Yeah.
Or something like that. It's like that. And I was like, this is insane, because now I have to make new PA school friends, which is not a problem. But then, like, I don't even know these people, and like, this is so weird. Like, this is not my PA school.
Right. But at least that you finished your didactic, right?
Yes, definitely finished the didactic. And then we had to, so the weird thing for this also was we had to go through, like, we had to take a bunch of tests, and we had to take our PAC rep, basically. Okay. As an entrance exam for the next PA school.
As an entrance?
Yes. Okay. Which was insane, because the PAC rep obviously gauges how you're going to do on the pants. And at that point, I'm like, I don't think I'm going to pass the pants yet, Yeah. I haven't even done my clinicals yet. But it was insane.
So what happens if you didn't do well on the PAC rat? Did they not accept the students?
So everyone luckily did get accepted.
Okay.
So I don't know what would have happened. I don't want to know what would have happened, because it would have been a bad.
Mm-hmm. I don't think they would have not let you proceed, though.
Exactly. I don't think it would have been where, like, they would not let us go forward, because we went through didactic. Like, we proved ourselves thus far.
Yeah, for sure.
So.
Wow.
It was definitely, Yeah, it was definitely something crazy. It was like I was so close to graduation. I would have been working right now, probably.
So I have a question. You did a year of didactic, and then you did a year of nothing?
No. So I did a year of didactic, and then we started clinicals. I would say like we started clinicals in May or April, I want to say. So, and we ended in December.
Okay. So
it
about
was like
3 months or so?
3 or 4 months. And in those 3 or 4 months, the school that we were accepted into, they had like it was called a boot camp course.
Okay.
And as part of the boot camp course, it was just like pretty much everything you learn in PA school all in those 3 months, you know, like just to make sure that we're prepared and like we're pretty much on the same page as their students as well.
Okay.
So that was that.
Got it.
And now I'm almost done. So that's all I care about. I'm like, I'm almost done with PA school.
And when's the graduation date?
It's in June.
In June this year. Got it. And you're done.
And I'm done. Like, finally.
That's awesome. Congratulations.
Thank you so much.
Do you still keep in contact with the other students?
So I keep in contact with a good number of them. Like, the other school is, I want to say, like 40 minutes away from where I am right now. Okay. So like we'll meet up, we'll go to happy hours, things like that. So we from majority of them, I still talk to them, or like at least I know what they're doing. And they told me their graduation day, so I'm gonna go to their white coat ceremony and everything too, just because I'm like, we were in this together. We got to support each other.
Nice.
So yeah.
And how are clinicals going for you so far?
Amazing. Yeah. Absolutely great. Yeah. I think I hit it off more in clinicals than I did in didactic year. Like clinicals, you get to apply yourself, right? And you get to show who you are. And I think I have that personality where I just love talking to people, and I just love, like, I'm a people person. So like being in didactic, it's great for me because I get to talk to my patients, you know, like it's awesome. I get to talk to these doctors. I get to be one-on-one with the doctors. So it's awesome. It's
definitely more fun than just being in front of a textbook all day.
Oh my God. Yeah. Because literally I remember being in PA school, we would be in school from like 8 to 5 or like 8 to 6 sometimes. I would come home and I would study. Like that would be my life. Right. And then on the weekends I would wake up, I would study. Yeah. And then now it's not as bad because you're around these people, you're learning on the job pretty much.
100%. So, what's your favorite so far?
My favorite rotation? I want to say so I did my elective in ortho surgery. Okay. And I had my general surgery rotation as well. And those are definitely Chap 2 contenders. Okay. And that's what you're looking to maybe go into? I'm looking into going to either general surgery or ortho surgery, just because, I mean, ortho surgery I never really thought I would be into, but from day one I was like, this is it. Like, really? This is what I wanted. Yeah. I was like, this is what I want to do. I was there for like 12 hours a day, and I'm like, all right, let's do more. Like, I want to do more knees. I want to do more hips. You know? Like, this is great. Yeah.
That's I actually had the opposite. I wanted to do ortho. Yeah, I wanted to do ortho. And when I did my rotation, I was like, I can do without it. No
way. Oh my gosh.
I remember falling asleep in surgery one time. I was just.
That's nuts.
Yeah, and the resident was super cool though. He was, I think, a second or third year resident there. Super cool, down to earth. Right. And it was one of those, like when we did ortho, I think we were there for like 80, 90 hours a week. Like we did 24-hour shifts, and I was just tired. I wasn't used to that. So he had me like help him, and I'm asleep. And the guy's like nudging me like, hey, you gotta like, just 15 more minutes, 20 more minutes. Yeah. Yeah. And I'm like, there's no way I want to do this. Like, yeah, that was it.
Actually, no, I loved ortho surgery. It was insane. And then like when it finished, so our rotations are 5.5 weeks long, and we have 8 of them. And then our last one is our final preceptorship. Okay. And I'm going back there for my ortho surgery.
Oh, there you go.
Final.
That's your interview.
Exactly. Yeah. And my general surgery, actually, I have a job offer for them as well.
Very nice. Congratulations.
Thank you.
Yeah. Thank you. And see that I know a lot of students worry about. I like one of the main questions I get from PA students is, does it matter where I go to school, right? Yeah. It clearly doesn't. You got a job offer before you graduated. Right. And the school you learned your didactic from lost accreditation.
Exactly. Yeah.
So it doesn't matter.
Even people, like, so obviously, I think the class before us, the last graduating class pretty much before we lost accreditation, the students that I talked to from there too, like they have jobs right now, they're working, they're doing great, they passed their pants, there was no issue with that. So like, I don't think it really does matter. I think you get what you put into things. 100%. And like a lot of PA schooling is self-study when you're at home and things like that, you know? So like you get what you put in. If you're not going to put in the work, and that's with anything in life. It's not just PA school. It's with relationships. It's with your parents, you know, like it's with anything.
100%. Yeah. When I was doing PA school, UC Davis, we only went up there once a month. Sometimes we didn't go every month. So we went up there for testing for the most part. Right. But it was all self-taught. Like we were there for a week. We had lectures for a week. Everything else was, you know, go ahead and read and then come back and take the exam. And so I don't know. A lot of people get tripped up on that, and it's what you put into it, like you said.
Yeah, like I'm going back to school tomorrow because it's our end of rotation. Yeah. So we're taking exams tomorrow.
Okay. Well, good luck.
So thank you.
And it's 7 p.m. over there, right?
It is at 7 p.m. here.
Okay. All right. Awesome.
Yeah.
Great. And so what made you get into this whole PA profession from the beginning?
So
what sparked this?
Honestly, and I mean, everyone could probably roll their eyes at me right now, but like medicine was something that came to me, right? Like, it's just like, I felt like it was my calling. Mm-hmm. And every Indian person out there is probably like, yeah, me too. Mm-hmm. You know, like, but I didn't want to go into medical school. I thought about it for sure. Yeah. But I didn't want to go into medical school because I wanted something more flexible. I wanted something where, you know, I could enjoy my life as well. Okay. And something where, but however, something I enjoyed doing because I don't know, it's just like most people go into medicine and like I want to practice medicine, but at the same time, like I said, I want to practice medicine with the flexibility of doing other things while being able to travel, being able to have a family, that kind of thing. Mm-hmm. So that was probably my biggest motivator for PA school or wanting to go into PA school. Okay. Is that what you told the admissions committee? Yeah, and it worked, right? Really? So, yeah. That's awesome. But yeah, no. That's awesome. Yeah, I think you asked me also why I chose PA or why I chose. Yeah, you had one of those like questions. Yeah. And so for me, it was just it was based more on logic. It wasn't necessarily I want flexibility, although that was a factor. Right. For me, it was the debt. Like there was no way that I could justify going into $200,000 to $400,000 into debt. Yeah. And then you have the problem where, great, you got into medical school, then you have to match into a residency. Yeah. So let's say I want to be a ER physician. If for whatever reason I didn't match into an ER residency, but I matched into an OB-GYN, well, guess what? Now I'm going to be an OB-GYN for the rest of my life. Right. And there's no other skills that I know. There's no other way I can make money. So now I'm going to be miserable. So it was one constant battle after another. And I'm not saying that's a good reason not to do anything because it's difficult or the odds are against you. Right. But I didn't want it that much to where I knew that I wanted to sacrifice and move to, for example, Maryland for 4 years of residency. I wanted to live in California. Right. You know? So that's one of the things too. Like, I know it's once you become a PA and once you are into the specialty or into I know like people say like I got into this because, you know, I can be a derm PA one day and an orthosurgery PA the next day. It's not that easy. 100%. But at the same time, it's doable. You know, whereas like let's say you're an MD, you have to go through a separate residency. You have to go through another 3 years of your life to do that. Minimum. You know? That's just for family internal medicine. Right. Exactly. Minimum. And it's like, let's say, what if you want to do surgery after you did family? Then that's a lot more, 100%. A lot more years that you have to put in. And I think with being a PA, you don't have to do that. You don't have to, you could put in maybe a year, you could put in just whatever, not 3 years, pretty much, you know, and get to the same. And it's not just it's not the time. I mean, the residents are getting paid $50,000 a year to work 80 hours a week for 3 to 4 years minimum. Right. Before they ever, and I actually sat down and did the math. By the time I would break even, by the time I would actually start making money, so long as I did everything correctly, I would be 40 years old. It's wild. But that's how old they are when they start, like breaking even and start making money. It's insane.
And to me, that didn't make any sense. Why?
Right. I'm 26 years old right now. I'm going to start working next year, and I won't be, like, I don't want to be on like a $40,000-$50,000 salary. I want to make more than that.
You know what my tuition was for UC Davis? It's $15,000 a year.
Wild.
So 30
That's
total.
Wild.
Yeah. I paid that off, I don't know, in a year or two.
Right. Exactly.
Yeah. So.
No, that's not my tuition at all. But.
And I stayed home, so I saved a lot of money. So.
That's awesome. Okay.
So that's awesome.
Right.
So knowing what you know now, knowing that, everything you've gone through, is there anything that you would do differently?
So knowing what I know now, I definitely wouldn't want to have lost accreditation, of course.
Obviously.
But I would say, like, because of all that did happen, I'm a stronger person because of it. I think it teaches you a lot to be resilient. It teaches you to, or at least I hope I'm better equipped to deal with different personalities when I start working, because I had to deal with a lot of different personalities when we we're going through that transition as well, and just a stressful time altogether. But I mean, moral of the story, the kind of like story that I want to get out to like other PA students that might be listening or that want to go into PA school is that tough times don't last, tough people do. So like, just keep pushing, keep chugging, and like you're gonna get to your end goal.
100%.
Yeah.
That's insane. I can't believe you went through that.
It was crazy. I think what helped a lot was my original classmate, like the original classmates that I had. We were an amazing group of people.
Okay.
We all really complimented each other really well, and we encouraged each other. Like, it was a good mix of personalities where like no one was really like super negative or anything. Like, we're gonna get through this. We're gonna get through this together, no matter what. We're gonna become PAs.
A lot of teamwork.
Like, yeah, a lot of teamwork, and you see that in the profession, which is, I mean, I guess it was like both. It was a positive and one, if you look at it that way. Right.
And I'm curious, did you have a lot of options as to where you wanted to go?
So it was those two options. And
no, before, I'm sorry, your original acceptance.
Oh, before my original, there was, so I didn't apply to that many programs.
Okay.
Just because it's expensive alone to apply to a lot of programs. I didn't want to, I'm originally from New Jersey and New York, that area.
Okay.
And I didn't want to really stay close to home either. Didn't want to be at home because I have a huge family.
Okay.
It's really chaotic in the house. I have a little nephew. So there's no way I would get work done. Like, even when I go home right now, there's no way I get any work done.
Got it.
But I wanted to be close enough, you know, that like if I could go, it's a 3-hour drive. So if I did want to go home, it was there. It was available to me. So I applied in like nearby areas. There's a few schools I got waitlisted to, and then I got accepted to this one. So before they even said anything back to me, I was like, I'm accepting this because like I'm in, you know?
Right. So. Okay. Got it. I was just curious to see if you were like kicking yourself in the butt or something, like, oh, I should have took the other.
Oh, part of me was, yeah. Part of me, I was like, I should have just waited. Like, but yeah, but it's over now. So.
What about clinical year? Any issues, obstacles, struggles?
Not really. Like, I think for like the 9 of us coming in, there was some hesitancy from the program we got into because they didn't really know us, which makes sense. Like, I get it, you know, like they don't know how we test take. They don't know like how much we know. So, but they're helping us go to our clinical. So it's like, are these students going to be okay? You know, like how are they going to do? But I think we proved ourselves really competent enough. And like, I think we're all doing really well. And
no pushback from the students or the professors?
They were surprisingly very accepting.
Okay. Nice.
I mean, yeah. So that was pretty awesome too.
Okay. And I'm curious to get your take, kind of on the East Coast, doing rotations with medical students, residents, physicians, attendings. How do they treat you as a PA there? It's hospital dependent, I guess I would say. Okay. Have you had bad experiences? Not really, but like some places just don't really utilize their PAs as much, I guess. Okay. And then others, that's all they use, you know, like it's the PA like runs a show kind of thing. And
the residents also, I think, the experiences that I've had with them, they're really helpful. Like, I know, like, if I had issues with something, or if I didn't understand something, or like if I didn't get diabetes insipidus really well or something like that, like they would sit down and explain it to me.
Okay.
Or even the doctors, they were really, it's a learning environment. And I think, like, especially when I did my surgery rotation, I would say, I was really scared because going into surgery is one of those rotations where you never know what's going to happen. And like you always hear these stories where like they're going to haze you and, like, don't break sterile field. Don't do this. Don't touch anything. And I'm like, okay, all right. Like, I don't know what to do. What, can I do anything then? And like, you go into the OR and they were actually so nice. And like, they're like, some of the doctors would even like take me outside of the OR before the surgery even started. And they'd be like, do you know what procedure we're doing? Like, this is what's going to happen. This is your role. And like, so it was really helpful to me.
That's awesome.
Especially in surgery, like family med, you're going to go see the patient. You know what you're going to do because that's what you're trained to do in PA school.
Right.
But surgery is kind of different. So it was really helpful for me for them to take that extra time, pretty much.
That's awesome.
Yeah.
Well, I'm glad you had a good experience. Were you the person I sent the email for Bernard?
Yes. So that was another thing that, like, another reason why your podcast is awesome, because so I heard the podcast from Bernard. He's an ortho PA from New York Presbyterian.
Right.
I contacted him through your podcast. And it was awesome. Like, he's super helpful. I was asking him about like post-graduation stuff and just like, what do I expect? How do I prepare for my PANCE and things like that? And actually, we're trying to meet up too, because back home for me is New Jersey and he lives in New York. Got it. And it's just like a 10-minute train ride for me.
That's great how that worked out.
So yeah, so I'm like, this is awesome. And like, it's just good, like, networking to have just like know different PAs and like just know their experiences and stuff like that.
For sure.
So I think it's awesome.
He's been doing it for a while, and
he
seems like a really great guy. So
he's awesome. Yeah, it was awesome to talk to him. And he was like, listen, I know you're ambitious, I could tell, but like, he's like you're just getting a little ahead of yourself. And I'm like, I know, I just want to graduate.
He's like, relax, just graduate.
I know, pretty much.
One step at a time. Are you planning on doing any type of postgraduate fellowship or residency training?
So I'm not. Okay. I struggled with it because whether I should do it or not, because I know I actually got an email recently and Johns Hopkins offers a surgical residency. Okay. And I think the biggest thing for me is also like just money thing, like where I want to start paying off my loans. I want to start just like the next chapter of my life where it's like, like I'm done with schooling. I don't want to do this anymore, or not do it anymore, but like I just want to start working pretty much. Okay. Got it. Yeah. So I don't think I am. I definitely did think about it because I know Cornell has a residency too. And like, and there's a surgical as well. And they have an ER residency. And I'm like, I could do this, but do I really want to, or do I just want to start working? And I think I'm going to start working. Okay. Got it. Yeah. I was really close as well. I was going to do ER. There's one in Lake Arrowhead, which is about an hour and a half from where I live. So I was seriously considering. I spoke to the residents. I did like an elective rotation there. I did my normal ER rotation there. I did my ortho rotation there on purpose so that I can go to the ER every now and then. So that was like the plan. And then, I got offered, I had the offer actually pretty early for the family medicine practice. I think before my first year was up. So I ended up just staying there. So I've been there since 6 years now. Since you like graduated? I was there as a student. So UC Davis had us start rotations after the first quarter. So after the first quarter, we were seeing patients. We had our main site, which is a primary care site, or internal medicine. Some other people had. So I was there from the first, second quarter of school all the way until now. And then, so that was our main site. We went there Monday through Friday. And then if we did an ER rotation, then we take like a month or two off from the main site, go do the ER, then we come right back to our primary care site Monday through Friday. Then we just go up for testing every now and then. Oops. All right. I think we got cut off there. It wasn't me. So great. So I think we've been chatting for almost half hour now.
So I don't know if you have any questions. You had some other questions. I don't remember what they were, to be honest.
I did.
So if you want to shoot.
So I wanted to ask you, so what made you go into family med? Is it because you were there like for your rotation and?
That was a big part of it. Yeah. There was like two brains going on at the time. One was I wanted to be the best at whatever I did. Mm-hmm. And you can never do that in family medicine because it's so broad. Like you'll never be the best at X. There's just too broad of a field to like really master any one thing. Right. So for that purpose, I was like, well, I really want to be good at either like emergency medicine, or if I don't decide to go that route, because that's still very broad, go into cardiology or neurology, or I wanted to do something specific. Right. But then the more I did rotations, the more I spoke to the residents, the hospitalists, the internists, I realized that even they get bored because they get tons of referrals that are very basic. Mm-hmm. And so that kind of turned me off. 90% of my day is going to be mundane. It's boring, routine things. If you work for a GI, you're doing endoscopies. I mean, like the routine stuff. You're there because of dyspepsia, heartburn. It's nothing crazy. And then to get to the advanced, interesting type of things would require a lot of work on my end as a PA to push the boundaries. And so that was one aspect. And then I'm like, well, at least family medicine gives me a broad range of things. And I started to like it a lot more because, all right, cool, I'll never be the best at whatever because of X, Y, and Z, but I'll be really good at this. And then sometimes I'll see, CHF, sometimes I'll see migraine, sometimes I'll see whatever. And the cool part about the practice that I was at the time, which is a little different than most places, is it was family medicine, OBGYN. So I had a lot of OBGYN patients. And we had we have a section where we take uninsured patients. So the patients I see on the side where we don't have insurance, are you still there? Ended again.
You're back.
You're back. All right. So the patients that I see on the cash side, essentially, they don't have any insurance. Completely type of demographic, completely different complaints. Because these patients don't have health insurance, they don't do their routine checkups. These patients wait till they get really sick to go into a clinic, an urgent care, or whatever, and see somebody. So that must be interesting to see. So it's a lot more fun, right? Right. And because they can't afford a referral to a neurologist, I tend to do a lot more with these patients. Okay. So my scope is bigger in a sense. Right. If I have somebody that's Medi-Cal and they have headache and I've done X, Y, and Z, well, now I'm going to refer because now the clinic's losing money in a sense. Like that's like the big picture here. It's we do what we can, but at the end of the day, if you're losing money at the clinic, you're not going to be in business. So do enough to get paid, I guess. And then once you've done your duties, it's now time to refer. But the cash patients, you can go that extra step further. I'm not saying I play cowboy or anything, but it's a lot more interesting and I can actually do more. And because I'm at the clinic by myself, it's not like I get to see the less complicated or interesting patients because I'm the PA. Like I'm the only person that's there.
Oh, cool.
So it's a lot more fun. So I'm like, okay, well, I can learn a lot more in this type of setting, which is why I've stayed this entire time.
So for where you are then, where does a doctor come into play?
He doesn't, or she doesn't. So the clinic is owned by a PA. Okay. So you can legally own a clinic here in California. PA can own a clinic so long as they don't own more than 51% of the business.
So I looked into that too, and I think it's like the same thing in New York as well. It's like 49% or something like that.
You can do 4951. The problem is if you do 4951 is the majority stakeholder is going to be the physician, means he has more power than you. So the way to get around that is to hire multiple doctors, and they each only own 10% of the clinic. You own 49. Now you're the majority stakeholder.
That makes sense. Okay.
Right. So that's kind of the way the setup is. The MD that's kind of on site, there's like 4 different MDs there. They don't really see patients. They're there more just to like check in. They're more there just to sign things off and make sure everything continues to kind of go the way that's supposed to go.
That's interesting. Okay.
Yeah. So it's kind of a loophole around the system.
Right.
Yeah. So that's why I chose to stay in family medicine.
Would you do anything differently?
No, not at all. Yeah. A lot of people, I get that a lot. You know, do I regret not going to medical school? And honestly, for family medicine, I don't think it's complicated. Like, I think anybody could do family medicine. And for me to go through 4 years of training as a medical student and then to do 3 years of residency in family medicine, I think is overkill for family medicine. I think it's completely necessary if you want to do anything else.
Right.
I just don't think it's all that complicated, especially because you're locked into a system that doesn't allow you to do anymore because of insurance and, you know, things like that. You can only do this, and then after this, you need to refer to a neurologist or a urologist or whatever, because we're not going to reimburse you. So it's not all that complicated. Yeah. And so, no, I wouldn't want to go through 7 years of schooling,
right?
$500,000
or like a
in
different
debt.
specialty, maybe? Would you want to do that?
No. And the reason being is it's funny the way life works. So I started this journey loving medicine, seeing patients, and then I started this podcast, right? And now it's growing. And now I'm getting tons of emails. There's a lot of opportunities. And I feel like I make more of an impact doing what I'm doing, like you and I having this one-on-one conversation that's going to go on the podcast, and then it's going to get distributed, and thousands of people are going to hear this interview. I feel like I make more of an impact doing that than if I were to have gone to medical school. And sure, I could provide better care, but me speaking with you is going to change the way you think a little bit, and in turn is going to impact all of your patients. Me emailing somebody, another clinician, is going to impact them a little bit, and it's going to change the way they treat their patients. So it's this domino effect, and it just kind of, it's like it trickles down.
Right.
So I feel more fulfilled doing what I'm doing now as opposed to
I think it's great, honestly. Like,
thinking like I should have been.
Right.
It's crazy. Like this is not the path I thought was going to happen for me, but I'm incredibly lucky. I'm grateful. I'm appreciative. I don't take it for granted. And so I have zero regrets.
Awesome.
Yeah.
So for somebody like me also, for students that are about to graduate, when would you give them, like, what advice would you give with regard to like when to apply for jobs or
apply now? I mean, you already got a job offer.
Yeah,
right?
but just like to keep the options open, I guess.
Yeah, no, just so.
Do you think it's okay to apply before, even if you haven't taken your boards yet?
100%. I feel like you should lock that in. If you have the opportunity to lock it in before you graduate, do it.
Right. Okay.
And I think you did it right, to where you did your rotations. You kind of had an idea as to where you wanted to go. And then your last rotation is going to be back at the place where you want to potentially work at, right? You're going to go with it. I think that's a great way of doing it, because 5 weeks of seeing somebody over and over again is the ultimate interview. You're not there for 30 minutes to an hour.
And our last rotation is actually 2 months. So it's even more than the 5 weeks.
So that if you're good at what you do, like, that's great. If you're terrible, then it doesn't matter what you do.
Then you know then, right?
Yeah. But I think what you did was perfect. Yeah.
Okay. Awesome. Well, thank you. Thank you so much. This
no
was
problem.
Awesome.
Thank you for your time. Yeah, we're at 4:40. Do you have any advice, any final words, any closing statements that you'd want to kind of give anybody listening?
I guess I would just say what I always say is just always stay positive, and always just if you want something, get it. Like, no one's going to do the job for you. No one's going to be there to motivate you. You have to be your biggest motivator. You have to be your biggest cheerleader, pretty much, and just go out and get it. There's no other way, you know?
Yeah, I love it.
Yeah.
Well, thank you so much for your time.
Thank you so much. This is awesome.